All right, everyone, let's get started. My name is McLemore. I'm a researcher at Human Rights Watch, and I'm welcoming everyone. Thanks so much for coming to Criminalizing Condoms, which just sounds like a spectacularly bad idea, and we are going to show you exactly how spectacularly bad it is. We are going to have a very interactive session today. We know that people are probably already growing weary of being talked at, so we're going to start with a movie that is going to, a very short film really, about the research that Human Rights Watch has done in the U.S. on criminalizing condoms. And then we're going to move to a film showing the research that OSF has done globally on this issue. And we're going to get brief summaries of the Human Rights Watch and the OSF research. And then we're going to hear from activists on the ground in the U.S. and globally, and we hope to have some in the audience as well. And that's the agenda. We're going to have we're going to throw it to an open discussion as soon as we can. We hope that it'll be very interesting and provocative and productive. So welcome again, and we will start with asking you to direct your attention to the TV screen, where the very short film that describes the research that Human Rights Watch did in Queens with the Latina transgender community there, talking about how this issue is a problem, very much a problem in that location of New York City.
Y Roosevelt Avenue en Queens, pues esta es una área donde polulamos las chicas transgéneras.
So I'm just going to give you a brief summary of the research that's in this report. The report is available here. We also have summary and recommendations and summary and recommendation brochures in Spanish, and by the end of this week we'll have the full report published in Spanish as well. But what we found was that in New York, Los Angeles, San Francisco, and the District of Columbia, that this practice of condoms as evidence of prostitution is going on to varying degrees. What we found in every city is that police are stopping, searching, and then warning and threatening with arrest sex workers or people perceived or profiled to be sex workers. And that's why this practice is affecting the transgender communities very, very hard. In some cities, condoms are being used when sex workers are arrested, or when people alleged to be sex workers are arrested. And in New York and Los Angeles and San Francisco, prosecutors are actually introducing the condoms as evidence at trials. Why is this a problem? Well, sex workers and transgender people fear arrest. They fear arrest because if they're immigrants, they can be deported or detained for prostitution offenses. They fear arrest because if they're sex workers or transgender people, they are very likely to have an abusive interaction with law enforcement officials, and we documented many of those in our report as well. The fear of arrest is making sex workers and transgender people more reluctant to carry as many condoms as they need. And we found in some cases that as a result of this practice, they were having unprotected sex with clients as a result. So what to do about it? Our recommendations focus on legislation barring the use of condoms as evidence of prostitution. That is legislation that we are going to focus on at the state level and the city level. We're also going to we have called upon the police, and we will be holding the police accountable for this practice, and we'll be calling upon the police and the district attorneys to pass directives stopping the use of condoms as evidence of prostitution. We also call for the repeal of these overly broad loitering laws under which people are being stopped and searched on very little grounds, very skimpy grounds that are not justified. And also, finally, we call for the Department of Justice to review the treatment by police of sex workers and transgender persons, because the context in which this is happening is also unacceptable. So that was the Human Rights Watch report, and now I'd like to introduce Acacia Ray, who is going to tell you about the global report that was done for OSF.
Hi, so I'm Acacia Shields, and I'll tell you briefly about the film that you're about to see, and then a little bit about the Open Society Foundation's research. This film tells the story of sex workers' experiences having condoms taken away from them in sex workers' voices. So I'll let you watch the film and then tell you about the research that went into it.
Sex worker.
I'm a sex worker.
Sex workers are human beings and we are their sisters.
I want to say to the police, stop taking the condom. Full stop.
All right, so as you can see from the sex workers' own statements in this film, sex workers are well aware of the damage done to them when police take their condoms away. The research for the Open Society Foundation's report, Criminalizing Condoms, was done by 7 sex worker rights organizations working in 6 different countries, in Kenya, Namibia, Russia, South Africa, the United States, and Zimbabwe. And even across these very different locations, sex workers reported strikingly common experiences. First and foremost, the police stop them, search them, and take their condoms away. In conjunction with taking sex workers' condoms away, police invariably used that moment of power against sex workers. So we have, together with being stopped and searched, sex workers experienced verbal abuse, they were beaten up, and they were raped by police who used that moment of leverage against them. Police also, in some locations, went a step further and destroyed sex workers' condoms right in front of them. Sex workers told us about police burning their condoms, cutting them up, driving over them with police cars, throwing them in the garbage. And sex workers are very much aware of the consequences of these police actions on their own lives. One sex worker in New York said, "Why do they take our condoms? Do they want us to die?" In Namibia, 50% of sex workers reported that they had their condoms destroyed by the police. And 75% of those who had their condoms destroyed by police and who then went on to do sex work had unprotected sex. We can see the consequences right there. We also found, as you saw in Human Rights Watch research, that police are using condoms as evidence to justify arresting or detaining sex workers. That means in some cases using those condoms as evidence for prosecution. In Russia, 60% of the sex workers we surveyed said that condoms were used against them to prosecute them on charges of prostitution. In other cases, police are using the fact of condom possession to illegally detain sex workers or to exploit them and extort them and further abuse them. We also have a phenomenon of outreach workers who are out on the street providing condoms to sex workers being targeted by the police. And I want to talk about two elements of that. On the one hand, outreach workers are being targeted directly. They're being abused and threatened by the police, in some cases arrested themselves for being out on the street handing out condoms. But also, police are using outreach workers as bait in order to catch sex workers with condoms. In South Africa, police followed the outreach van in order to target sex workers. One clear prerogative from all of this is to bring law enforcement practices into sync with programs to prevent HIV. At the very least, police need to stop taking people's condoms away from them. They need to stop using them as evidence. But to take it a step further, we need to decriminalize sex work. We need to reframe the dynamic, and we need to make it okay for sex workers to be out on the street doing their work and protecting their health without fear that it's going to be used against them. Thank you.
Thank you very much. That was a beautiful, beautiful film. Now I'm going to introduce two of the U.S. activists who worked with Human Rights Watch as partners on our research project. The first is Sienna Baskin, who is co-director of the Urban Justice Center's Sex Worker Project in New York. And she is a New York City national and international advocate for sex worker rights. We also have Bamby Salcedo from Los Angeles. Bamby is the project coordinator of HIV prevention services at Children's Hospital in Los Angeles. She's a proud Latina transgender woman. She's a former sex worker, and she's also an active member of the Transgender Services Transgender Services Provider Network of Los Angeles.
And I'll go ahead and introduce two of our other speakers who came a long way to join us today. Sian Maseko is the director of the Sexual Rights Center in Zimbabwe. She's done extensive work. She has a fan club. She's done extensive work on LGBTI rights and sex worker rights, and she's lobbied for legislation to promote women's rights, including the Domestic Violence Act in Zimbabwe. Stacey-Leigh Manoek is here from the Women's Legal Center in South Africa, where she's an attorney leading the advocacy and documentation efforts of the Women's Legal Center, and she's also worked extensively on women's rights issues and sex worker rights.
So we're going to direct a few questions to the panelists, and then we're going to open everything up for discussion. My first question is to Bamby, and I would just like to ask, play devil's advocate here for a minute and ask, why is this practice a problem, and aren't police just doing their jobs?
Hello?
You gotta talk right into it.
Hello? Oh, sorry. First of all, good afternoon, everyone. And thank you so much for being here. As it was mentioned before, my name is Bamby Salcedo, and I am very privileged to have a job as a trans woman, which is not the case of many members of my community. I do want to mention that, again, I used to be on the streets, and I have, lived in my own experience what type of situations we go through when we are on the streets. And I was an outreach worker, and it was mentioned, you know, that the type of harassment that we go through. I remember on the early stages of when I started working, doing this kind of work, when we used to go to downtown LA to provide health education to trans women and condoms, I used to get harassed along with my partner, you know, and we were told that what we were doing was just a facade, that it was just, that we were doing sex work, and that like the bag that we had and the information that we had, it was just to pretend that we were doing something. So that was almost every single time that we were in downtown LA. But the good thing about it was that, you know, we just kept on going because it was part of our job. And as it is a dangerous job, because when you're out there, not only the police think that you're just, you know, there doing your facade, but also people or Johns, you know, that are trying to get, you know, sex with other women or sex workers on the streets. So, for what I know now is that I still work with the community. And I do want to say that I am also part of an organization that is called the Trans Latina Coalition. And we're doing work extensively really to advocate for the rights of trans Latino immigrant women that reside in this country. But I also work with youth, with young people, for my paying job, if you will. And what I hear is the same, you know. I hear it from the Latina girls, and I hear it from the young people who are on the streets, who are driven to the streets because of the societal constructs and the mentality that the police have. In my opinion, it is a military mentality. Like, they have this mentality that it's just, I'm sorry my French, but it's just fucked up, you know? So, yeah, it is. I mean, you know, we have been doing work in Los Angeles with the Los Angeles Police Department, and we have tried to do some work with the Sheriff's Department, which is sort of like the larger entity. And I mean, I honestly can say that through the 10 years that we have been trying to do work with them, we have done very, very little, you know, and that's because it's hard to change people's minds, and it's hard to change cultures, you know, because I can honestly say that law enforcement is a culture, and it's a culture, again, in my opinion, like a military culture, so to speak. So it is a problem because you know, our rights as an individuals, our rights as a right to health is continually being violated. And unfortunately, it's hard to infiltrate into those institutions. So I am really proud and happy that we were able to collaborate with Human Rights Watch, and that, you know, we're able to bring light to this issue, because it's an issue, it's an ongoing issue. I mean, it's happening today as we speak. It happened last night, and it continues to happen. But I'm very hopeful that with this report and with the stuff that we're doing with other organizations, that we're going to be able to change some of those structures, mentalities, and that we are going to be able to make changes.
Thank you, Bamby. Sean, I'm going to ask you the same question. Aren't police just doing their jobs?
No, the police are not doing their job. Policing condoms is not the job of the police. And this is all part of a vicious cycle of intimidation and harassment aimed at sex workers. And as Bamby just said, it's fundamentally violating sex workers' right to health. It's also preventing sex workers in terms of accessing health services and health provision. Because the police are equally targeting outreach workers. The outreach workers are equally becoming reluctant to work with sex workers, to distribute condoms, to carry condoms. And this again is part and parcel of, I absolutely agree with you, police policies to intimidate and harass and exploit sex workers and violate their rights.
I'd like to go ahead and ask a question of both Stacey-Leigh and Sienna. I'd like to know if there was anything during the course of the research or when you went and looked at the findings, anything that surprised you that came out of this and you said, wow, I had no idea that was going on.
Thank you for inviting me. And I just wanted to mention 3 things that surprised me during this study. And the first thing is that on one hand, we have the Department of Health and handing out condoms, campaigning vigorously for sex workers and other key populations to use condoms. And then on the other hand, we have the Department of Justice using condoms as evidence against sex workers and destroying and confiscating them. So that was a big deal for us, especially with our partner Sweat, who works closely with the Department of Health in handing out condoms to sex workers and then having it destroyed and confiscated it from sex workers later. The other big issue that surprised me greatly was the fact of the ways in which sex workers would hide their condoms. So for example, we were told that they would hide it in their breasts or on the pavement or in their shoes, and that damages condoms, and later would use those condoms while working. So that was a big surprise to me. And then another big issue was the outreach workers, as my colleagues has mentioned. Outreach workers being harassed during their outreach activities, and also outreach workers being followed by police officers. So soon, straight after they've handed out condoms, the police officers would identify who the sex workers are and arrest them. Thank you.
Thank you. My name's Sienna Baskin again. I'm with the Sex Workers Project at the Urban Justice Center. We've been working on this issue for 3 to 4 years now. So in a way, the research findings were not surprising because we've been hearing about this, the confiscation of condoms from sex workers for so many years. But it is always a little jarring to see it in black and white in a Human Rights Watch report or in an OSF report to see, oh, these stories I'm hearing are now, documented. I think one surprising finding, and this was in the course of doing the interviews and the surveys, there was a question in the Open Society Foundation survey that was really, I think, trying to get at all the different kinds of harassment and arrests that sex workers face and how common they are. And one question was, have you ever been asked for a bribe from the police? And when we asked that question of sex workers in New York City, they responded with stories of being asked by police for sexual services in exchange for not being arrested, being extorted for sex, which we also know is common, but it was so common that this report wasn't even about that, and these stories started coming out that people are being extorted for sex. And so to me that just paints a picture of this issue of condoms being confiscated as evidence of prostitution is one form of police misconduct towards sex workers, and but in a way it's the tip of the iceberg. Thank you.
Thank you. Bamby, you have something else to say?
I just want to add a little bit to what it was just mentioned. I mean, I just thought of an experience that I had when I was in Mexicali a few years back. There were a couple of experiences that I had related to what you were talking about. One, I was picked up by the police, and I was taken away. Obviously, my condoms were taken away because, you know, I was doing sex work. But how I was, I guess, raped or basically what I was told is like I was not gonna get arrested if I would have sex with them. You know, like if I would do oral sex. Right, yes, thank you. Sorry, my ESL's kicking in. So that was something that I experienced myself. And then another thing was that, so I had to do that. So that's, you know, that's sexual violence, you know. And another thing that happened is that they would take your condoms away, and they didn't take me in, but they took me far, far, far away. Like, and they just dropped me off there. They ripped off my clothes, and you know, it was just dehumanizing, you know. And no money. They took everything I had. They took my money. They took my condoms. They took everything I had, and I just, you know, it was just awful to be on that position, to be naked, I don't know where, on a dark place, and you know, with really like, it's just dehumanizing, really. But that was what happened.
Thank you, Bamby. All right, so those are the sort of warm-up questions and the kinds of questions that we, you know, encourage you to ask. But we're going to open this session up now, and we'd just like you to be able to really hear from the people in the field, the people on the ground, the women who are dealing with this on a daily basis. So please, any questions? Yes.
Step up to the microphone.
There's a microphone there. If you could use that, that'd be helpful.
Testing. Hello, Karen Baird, New York City. I'd like to hear from the panel, what do you think we can do to try to stop these policies and practices technically on the ground? How can we advocate, change the laws, change the policies, go to the police departments, go to the legislatures? What should we be doing?
Yeah, we were going to wrap up this panel by talking about those ideas. So let's do it now. Speaking from New York and from the U.S., we have a campaign, and I actually brought some brochures because we participated in this study as part of a network called the PROS Network. It's a network of service providers, sex workers, activists, media makers that want a harm reduction approach to prostitution in the city. And so we collaborated on these reports together, and we have a campaign to pass a bill in New York State that would not allow condoms to be used as evidence of prostitution in criminal or in civil matters. We've been working on this bill, like I said, for 3 years, and we still have not passed it. So in a way, this issue has that sort of like duh effect, you know, audiences here, like this is such an obvious injustice and something everyone can understand, and everyone would want to support this change, and yet law enforcement is very powerful, and the forces that want to keep sex worker crime and keep sex workers out of public space are very powerful. And so we need all the allies we can get on this campaign, and there's a website called nocondomsasevidence.org, very easy to remember. And there's updates on there. We have a listserv. You can be part of this campaign. Really, like everyone can. We need people with ideas, with knowledge about how state laws are passed, with connections to people that can make this happen in New York. And hopefully that will be a model for the rest of the country.
Stacey, did you want to reply as well?
For South Africa, I think the main thing that we'd like to see is the decriminalization of sex work, and I think that will definitely assist in addressing the human rights violations that sex workers experience. And on top of that, to have legislation similar to the New York bill that will prohibit the police from using condoms as evidence and trickle that down through national and local governments.
Bamby? Yeah.
I just want to add a little bit to that. I think a couple of things that we can do to support all of these efforts. I think one of the main things that we need to do is to educate ourselves about what is going on. There's some great reports that just come out. Please find out what the reality is. So let's educate ourselves, be involved, like they were saying, you know, participate into making sure that we together create changes and that we can also change those structures that continue to oppress us. I would also encourage for all of you to support Human Rights Watch and, you know, donate. Go to their webpage and donate. They're doing really great work, and also they're wonderful organizations. I mean, those are ways that we can definitely, you know, support the work that people are doing. And another thing that I think is also very, very important is that we need to hold our politicians accountable for what they say they're going to do, for them to do it, and not just for them to say it. And, you know, it is an election year, and we need to get on it. And next year, you know, let's follow up with that. What's going on? What's up? You know, and I just think that's really something that we should do.
Yeah, I mean, I think this is one issue that's part of a bigger pattern of abuse, and I think working with the police is very challenging. But I mean, one of the things that we found in Zimbabwe as in South Africa is that very rarely does the confiscation of condoms lead to criminal prosecutions. It's very rare that they will actually get that far down the line. So I think that what we really need to do is use this research as an entry point with healthcare service providers and ministries of health to demonstrate that this is having a really serious and wider impact, but that it's also another kind of weapon against sex workers. It's another reason for police to stop and search and harass sex workers. So I think that that's also one of the kind of key issues. I think from our perspective in Southern Africa as well, the voices of sex workers are extremely important. And I think allowing and ensuring that sex workers are represented at places like this is really, really crucial to ensuring that these issues are addressed, because sex workers have a really important voice and they have really important experience that needs to be shared, and that needs to be profiled. And I think that allowing sort of sex workers to register their organizations and ensuring that sex workers are represented at higher level dialogues, that's really, really crucial.
All right, can we take the next question from the microphone?
Good afternoon, everyone. My name is Sienna. I'm the National Coordinator of Sisonke Sex Worker Movement in South Africa. I've got a few comments and one question. I think that because we as a movement, we also conduct outreach with sex workers. What it has been said by the panelists are the difficulties that we come across during outreach. Also, just to emphasize that our peer educators on outreach are sex workers. At the same time, I think when police are harassing them and asking them questions that are they promoting sex work, I think it is something that they are used to it. It's difficult for them to say no, to say yes, because it is something that they are used to it, being harassed by police. And I also think that criminalizing condom in South Africa, it is a big problem in other countries, and it is something that we need to act on it immediately. My question would be, I don't know if there is something that can be done, like something big like this it's either a march or it's submission or something around this issue, because it is really affecting sex workers, and it makes sex workers more vulnerable to practice safer sex. It makes them more vulnerable to diseases and HIV. It makes them more vulnerable to anything, because police are taking advantage. At the same time, police are the one that are raping sex workers. Just an example, one of the sex workers was raped in Durban, and she asked the police that, can't you use a condom? And the police said, what do you know about condom? And that makes me feel bad, because people keep saying bad things about sex workers, that sex workers are spreading HIV, and we know for sure that the sex workers are practicing safer sex. And then the other thing that I always emphasize when I'm doing interviews is that when I'm doing interviews, people like to ask the question of sex workers spreading HIV. And my question to them, I always said, as a national coordinator of the sex worker movement in South Africa, I've visited many provinces. We've implemented 4 offices in 4 provinces. I've never heard of a sex worker saying that I told that client that I don't want to use a condom. But what I've heard is that sex workers would say clients don't want to use condom. So yeah, that's my biggest thing that I wanted to share with you today. And then I also think that government needs to intervene in this, or we need to invite the government, because if the police are criminalizing condom, they are government. And then some of our projects are funded by the Department of Health. So for me now, it's like a scapegoating. Somehow, excuse my French, but this is true. Because if government are providing condom and then the police are criminalizing condom, so there is something that is wrong there. And not to say they're not aware of that, they are, it's just that they're ignoring us. But I feel that it is time for us to act. It is time for us to take action against it. It is time for us to fight it, because when police are confiscating condom, they are violating the rights of sex workers to use condom, because whether you're a sex worker or not sex worker, but you've got the right to use condom to practice safer sex in order to protect yourself in this kind of diseases. Thank you very much.
Thank you. Let's take one more question.
It's more of a comment. Gosh, I gotta scoot down, I think. For the last 3 years, I've had the privilege of being the executive director of the Sex Workers Outreach Project in Sydney, Australia. I'm originally from the States, so don't be fooled by my non-Australian accent. So I just want to say that I guess I want to provide a voice of hope and be able to balance this with how good it can be in a decriminalized model. Sydney and New South Wales is one of 2 places in the world that operates in a decriminalized model. The other being New Zealand, which has a bit of a different kind of deal with certification, but we won't get into that, but it's still a good model. And I just want to say that for us, police are advocates. We just recently developed a brochure that we were asked to design by the King's Cross Police, which is the biggest kind of police local area command, for them to hand out to sex workers, providing them with advice on where to get housing or accommodation or legal aid. So we designed this with them. We run, ugly mugs, as most of you would, where sex workers can report violence, that's come to them, and those go over to the police detectives so that they can. So I guess I just want to say that I was hesitant to even get up here because I thought, gosh, I almost feel guilty getting up and saying about how good it can be. But I think you need to understand that when decriminalization, it is key, and I know somebody said that's what you have to. Absolutely, there is no other option. It is decriminalization that will lead to all of these things that we're talking about. We know it. We're not making it up. We also know that sex workers in New South Wales have high 90% use of condoms. That's some of the highest in the world, and we have the lowest rates of HIV of anywhere in the world. Hello, we didn't make that up. This is true. So I just want to say, keep up the fight. Wherever she just went, I'm with you. It is a fight, and it can get better, and there are places in the world where it is. So, yeah.
I would just like to add something to that. To heartily endorse that, and also, I think that what we can do here is start to tell the police that public health is part of their job. And I actually have been doing that and telling each of the police departments in each of these cities, along with the advocates, that they should actually be handing out condoms to sex workers, to transgender women. And you should see the look on their face when we say that. But I think the more we say it and say that part of public safety is public health, it'll help move them away from the military model that you were talking about, and a little bit more towards at least some awareness that public health is actually part of their job.
I also want to add that the reality of things, like, it's wonderful that there are models that work and that people are working together, but the reality is that in some developing countries, the reality is different. I can only speak as a Mexican trans woman. I think what we need to do is at the same time try to empower sex workers, for them to understand what they can do to better their reality in whatever areas we can. So I would encourage for those organizations that have the power to change some of those structures and invest on human rights issues to go and do that.
We have a next question.
Hi, Cindy Clay from Washington, D.C. My organization participated in some of the reports. When I just, again, quick comment, was to mention that I wanted to make sure that it was mentioned that it's not necessarily people who, look like me that are getting harassed by the police. This is a tool and a method for which they are using to criminalize and harass women of color, trans people, and people who no one wants to see, who people believe that they don't belong in certain areas of our city here in Washington, D.C. And what's even more frustrating is after the report came out, I feel like law enforcement has been saying, oh, we don't do this, this is an urban myth, this isn't really happening. And I'm frustrated at, yet another time where women and trans women are speaking out against this practice against them and aren't being believed. And it's frustrating, and this is part of a larger attack on, the reproductive rights and health and justice for individuals in our city, especially for women of color and for trans women. And I think it's really important that we take that lens to this, because, they can't just tell us that we're lying. And it's reports like this that are going to help us spread the word. And these aren't isolated incidences, and I just wanted to see if there was any more comments on that.
I think, I think you're absolutely right. We have to apply the lens of intersectionality because there's multiple discriminations. I think the issues we have in Zim are also linked to the law as well. We have sodomy laws, which obviously impact on male sex workers. We have just general sort of loitering laws, etc., that kind of create a sort of vulnerability for women generally. But I think the point that you're making, and I think it's absolutely right, is that these kind of policies and these practices are reaffirming the marginalization of sex workers and pushing them further to the margins. And I mean, in a lot of ways, that's the strategy. It's considered to be a problem, it's considered to be an issue. During the World Cup, for example, they were raiding brothels and bars and arresting sex workers randomly under the auspices of it almost being the World Cup, which was happening in a different country. We have those moments. So my point is really that really is the strategy, is to marginalize even further. And I think that this issue now of accessing the right to health, this issue with condoms, now it's kind of another thing that they're kind of adding to the potential ways that they can arrest sex workers. So I absolutely agree with you.
Sienna, do you want to talk also about the profiling issue and some of the research you did?
Oh, yes. Yes, and that is so true in New York. And in fact, the neighborhood that was profiled in the first video is a neighborhood we work with very closely. Basically, in New York, there used to be a lot of street-based prostitution in Manhattan, the center borough, and much of that has moved out to the outer boroughs because of really repressive policing in Manhattan. This is one neighborhood that still has a lot of street-based prostitution. There are many other neighborhoods as well. And it also has the benefit of a very organized and empowered transgender community. And they really pushed us to make this a priority. In spite of, these are women that have experienced the highest levels of repression in their home countries, in the United States, the highest levels of violence you can't even imagine. And yet they said, this condoms thing, we gotta do something about this, because it's so invasive, it's so wrong, and it disables us from being able to have that basic level of protection of our lives. And they are targeted more than, I would say, in higher numbers than any other population of sex workers or of women or men in New York City, because being transgender, being on the street, going to get a jug of milk, you can be arrested for prostitution or loitering for prostitution. And so these issues really overlap for them.
I think, Stacey, you want to comment on this issue as well?
Yes, in South Africa we found that sex workers were being profiled too. So for example, there's one sex worker who said she went out and did her grocery shopping, and on her way home with grocery bags, a couple of police officers stopped her with a big van and said, who are you, what are you doing, and can you give us your contact information? And she had to give her address, family's addresses and contact information, and then they took pictures of her. And when she asked, why are you taking pictures of me, she was told, no, in case you die or go missing, we can find you and notify your family, which is absolutely ridiculous. But we also found that as a result of the profiling and creating a database of sex workers, that during the study we found that often sex workers were then approached because the police know that they are sex workers, and when they find condoms, that then they are unlawfully arrested. And that's how the profiling aspect affected sex workers in South Africa.
Well, thank you, everyone. If there are no more questions, we'll be available right here after the session for more information. And then I just want to thank all of our panelists and people from the field and everyone for coming, because this is a very important issue, and we're going to continue to work on it all together. Thank you.
And take some reports.